everyone and welcome back to our channel Forensic Mart. Today we are here with a case study related to dowry. Fly solve dowry death mystery, a case report. Introduction. The bestowing of dowries is an ancient tradition, unlike the Western concept of a single bride payment. The Indian tradition consists of an ongoing series of gifts both before and after the marriage to appease husband and his family. India has by far the highest number of dowry related deaths in the world according to the Indian National Crime Record Bureau in the early 1980s and 90s. Most dowry deaths occur when the young woman is unable to bear the harassment and torture and unfortunately she commits the suicide. Most of these suicides are by hanging, poisoning or by fire. Death related to dowries or dowry deaths has been described under section 304B of Indian Penal Code as when the death of a woman is caused by any burn or other bodily injury or occurs other than under abnormal circumstances within the 7 years of her marriage and it is shown that soon before the death she was subjected to cruelty or harassment by her husband or by any relative of her husband's for or in connection with any demand for dowry, such death will be deemed dowry death and her husband or relative will be deemed to have caused her death. It states that within the 7 years of her marriage, if she gets any burn or bodily injury and dies and she was subjected to the cruelty or the harassment, then such death will be deemed as a dowry death and for that husband and her relative will be deemed to caused her death. In dowry death cases, a magistrate inquest is undertaken and the burden of proof lies on plaintiff. Here, in the mystery or the suspicious condition, a magistrate can inquest for the further investigation and this will lead to the solve the mystery of the cases. The National Crime Record Bureau says that there were over 6,000 dowry related deaths every year. There was also surge in dowry related deaths, that is from 400 a year in 1980s to 6,000 a year in 1990s. Most of the victims reach hospital too late when the poison has already been absorbed and thus many died within 24 hours. Case report. A dead body of 30-year-old female hailing from a village of Haryana was brought to the Department of Forensic Medicine PGIMS Rohtak for post-mortem examination. The deceased was brought to emergency department for treatment but was declared dead on arrival. As per police information, the apparent cause of death was by putting pressure over the mouth by pillow or forced poisoning. Gross examination, that includes the outer examination or the gross external examination. It states the dead body was wrapped in a polythene sheet. It was wearing white suit salwar, bangles in right wrist, bracelet in the left and hairband loosely present in the hairs. Rigor mortis was present in passing of face. Post-mortem staining was present over the dependent parts of the body except the areas of contact and it was fixed. Reddish colored secretion were oozing out of nostrils. Blood vessels of shoulder, upper chest and bilateral inguinal region showed marbled appearance. A greenish discoloration was present over the right lower abdominal region. A reddish grazed abrasion of size 2 into 3 cm over the lateral aspect of the right malleus was only the injury present over the body. So, firstly, in the examination, it was recorded that dead body was wrapped in a plastic or the polythene sheet, and the appearance or the wearing apparel she was wearing that were described, and any ornaments were present that were described on the first note, and in second the rigor mortis was present, and the staining or the discolorations were found on the body that were on the rest position. And other than that, there were the blood vessels of the shoulder and the upper chest and bilateral inguinal region shows the marbled appearance. Then the later on greenish discoloration was present over the right lower abdominal region. On dissection, the brain was congested, that states that blood or any body fluid were accumulated over the brain region, thorax wall, ribs, cartilages, larynx, trachea were healthy and hyoid bone was intact. Both lungs were congested on the cut section. Heart and large vessels were healthy. Stomach contained about 100 ml greenish grey colored viscous fluid with spirituous disagreeable odor. Mucosa was hypermic with patchy hemorrhages. Here the first figure shows that hemorrhagic spots on stomach mucosa along with the grey discoloration. Then in both other images, here the dead flies were observed over the dissected viscera. Viscera is the sample which we are taking for the further analysis in the toxicology division for any kind of presence of poison or any other harmful material. Discussion. The findings of post-mortem examination did not indicate the manner of death suggested by the police or alleged by the next kind of deceased. Sudden death of flies over the body viscera indicated that something toxic was present in the body causing the death of these flies, and this poison must be in sufficient concentration to the flies instantaneously, hence most probably an insecticide. So as per the post-mortem findings and the examination, the death manner was not that accurate or the nearby that is indicated by the police, and the sudden death of the flies over the viscera, it conclude that there was a present of any harmful poison, and that also in the sufficient amount that the flies dies over that, and that was particularly a insecticide. Chemical examiner report confirmed our observation, which stated that organophosphorus insecticide was detected in all the preserved viscera. The case alleged to be a brutal homicide turned out a case of suicidal poisoning, just with a vigilant eye. Thank you for watching the video, and for more such case studies, subscribe the channel Forensic Mart and press the bell icon so that you will be notified for each and every upcoming video in the Forensic Mart.